Myself Dr. Manisha Deshpande. Today we will be discussing the pain in the shoulder and frozen shoulder. Now why one gets a pain in the shoulder? So this pain in the shoulder can be because of the disc prolapse in the cervical region. So all shoulder pain cannot be you cannot term it as a frozen shoulder. You have to first isolate what is the cause of this shoulder pain. So it can be a radicular pain because of the prolapsed disc in the cervical region. It can be because of the injury in the shoulder which is seen in the sports person or the person who are doing repetitive kind of work in the same manner. So this leads to the degeneration of the rotator cuff, or it can be a injury or a traumatic injury to the rotator cuff, which is a chief group of muscle, 4 muscles which supports the shoulder joint. So radiculopathy, rotator cuff injury, then it can be a degenerative or infective focus, often the TB of the shoulder joint. Then it can be a frozen shoulder, which is commonly seen, which is called as adhesive capsulitis, frozen shoulder, or periarthritis of the shoulder joint. So if it is a instability because of the rotator cuff injury, the set of exercises will be different. Then here we are focusing more on the strengthening of the rotator cuff and decrease of the inflammation in the rotator cuff. If it is a frozen shoulder, what can be the reasons for the frozen shoulder? Most common reason is the diabetes. If the sugar level is not controlled, then the patient often present themselves with the symptoms of frozen shoulder. Then frozen shoulder is often idiopathic. What do you mean by idiopathic? That is without having any reason. Sometimes there is a calcified tendons or the calcium deposits in the shoulder capsule which is seen in the aged people. So that is also one of the cause for getting the frozen shoulder. And frozen shoulder is often associated with extreme pain during night time. When the patient relaxes, that time the pain triggers. And once he starts moving around, the pain decreases. So and the frozen shoulder is seen in the 3 phases. So in the early phase, if you take address of this condition, then it is recovered early. Otherwise, if you go by the physiological means, it often takes more than 6 months to recover from the frozen shoulder. So the treatment of the frozen shoulder includes, first is and foremost is the reduction of the pain. Again, there are various physiotherapy modalities which the physiotherapist assess